All right, so good afternoon, everyone. My name is Elizabeth Roldan. I'm here joined by my colleague, Julie Servideo, and we are from IMAC Insurance Broker Agency. We are the insurance brokerage for the Hillsdale School District, and we handle your medical, prescription, and dental benefits. We are here to go ahead and assist you with any benefit questions or claim matters that you're dealing with currently. So even if you have a claim that you're working with through your through your current plan through the state health benefits, we can certainly advocate for you and help you with that claim. And we actually encourage members to go ahead and reach out to us directly, as we usually have faster responses regarding claim or benefit questions than you reaching out directly to either the state health benefits or moving forward once the district transitions to the Metropolitan Health Insurance Fund. Members can call our office at 973-450-9800, or they can send us an email at info@imacagency.com, and we will get back to you. I know that we've already begun working with quite a few of you that have had some prescription questions and other benefit-related questions regarding the transition. So please continue to go ahead and reach out to us, and we can certainly help you with those answers as well. So beginning March 1st of this year, the Hillsdale Public School District will be transitioning its current medical and prescription plans from the state health benefits to Aetna for medical and Express Scripts for prescription through the Metropolitan Health Insurance Fund. The benefits during this transition are guaranteed to be equal or better than, and that's in writing that we have a letter from the Metropolitan Health Insurance Fund. And due to this change, you can make a plan change if you would like until January 23rd of this year. So for example, your benefits that you've elected within Benefit Solver last October during open enrollment, if you are not making a change to that, those benefits will roll over into the Aetna and Express Scripts plan equivalent. But if this is something that you're looking to maybe move from Direct 10, for example, to the Educators plan, that's something that is an option now due to the transition, and you have until January 23rd to do that. Regarding your dental coverages, there is no change happening with that, so those coverages remain in place. But if you do waive your coverage, you definitely have to go ahead and complete and submit a waiver form. If you are someone that has an overage dependent that has currently medical and prescription through the state, you would need to have that overage dependent re-enroll with Aetna and Express Scripts. If that's a situation that's applicable to you, I highly encourage you to reach out to us so we can go ahead and help you with that process and complete the proper forms for that. But as I mentioned, if you wanted to stay in the same plan that you elected back in October on Benefit Solver, that is the information that we will be using to load your coverage into Aetna and Express Scripts for this transition. So there is no action required on anyone's behalf that is not making a plan change. I'll take this opportunity to answer a couple of questions that I see here. Will our prescription deductibles be rolled over from Optimum to Express Scripts? Julie, I'll let you tackle that one.
No, they will not roll over. So the deductibles that you have are embedded for your medical and your prescription, so it's all one. Optum will not release a file giving us everybody's accumulation. So if anybody has met anything, they just have to provide us with a statement from the account that shows it, and we'll have it carried over to the new Express Scripts and Aetna plans.
Perfect. Thank you, Julie. Another question that I'm seeing here is someone who's asking regarding referrals, and none of the plans that are being offered, which are they were matched exactly to what you have now. There are no referrals required. So as I mentioned, the benefits are guaranteed to be equal to or better than. So because none of the plans currently require a referral, you do not need a referral for anything as the transition happens to Aetna. If you are currently using a Horizon plan and that doctor does not participate with Aetna, for example, and if you're going through a treatment such as a pregnancy or a cancer treatment or anything like that, there is transition of care coverage that will ensure a smooth transition for you for your treatment to continue. So please reach out to us and we can certainly complete those forms for you. But I can tell you that between both networks, Horizon and Aetna, there's about a 95% overlap of doctors that live in both networks. The network that is used for Horizon, for example, in the state is is Horizon's largest network, as is the network under Aetna that will be used for your transition. So there is a tremendous amount of overlap with not only doctors, but hospitals, urgent care. So we don't really foresee that there'll be many, if any, situations with employees that are going to a doctor in Horizon right now that may not participate with Aetna. But again, reach out to us if that's something that is applicable for your situation. So the 4 plans that are being offered through Aetna and the Metropolitan Insurance Health Fund are the same that you currently have. So you have the 10 plan, which is the equivalent to the NJ Direct 10 and Freedom 10. You have the Freedom, the 15 plan, which is the equivalent of the Direct or the Freedom 15. And the Educators Plan and the Garden State Health Plan are also options for employees as well. Your plan options and what you're available to choose from is based completely on your date of hire. So again, the same rules apply as they did with you being in the state. So if you were an employee that was hired on or after July 1st of 2020, the only plans that you can choose are the Garden State and the Educators Plan. But if you were somebody that was hired previous to July 1st of 2020, you can elect from any of the 4 plans that are being offered. But again, if you are not looking to make a plan change, we are literally just taking that enrollment data that is in Benefit Solver right now, and that is what's being provided to Aetna for medical and Express Scripts for prescription. And again, just as a reminder, as it is now, your medical plan election determines your prescription plan election. So if you're somebody in Direct 10 or Direct 15 that is looking to move into the Educators or the Garden State Health Plan, your prescription would change should you make that change on your medical plan. So again, important to note there. And we are going to be getting into a little bit more detail regarding I'm sorry, if you could just make sure that you're muted. I apologize. There's feedback or interference coming back.
I was on Direct 10, and then I just switched October to the educators plan.
I'm sorry, if we could just make sure that everyone's mic is muted. There's feedback coming through. I apologize. Okay. So with that said, because of the transition, everyone in the district will be receiving new ID cards for both medical and prescription. Those ID cards will be sent to you by mid-February, so way in anticipation of the March 1st effective date of your new plan. And one of the big takeaways for today is to make sure that when you receive your cards that you begin presenting those cards at your doctor and pharmacy on or after March 1st. One of the top things that we hear when there's a transition like this is members saying, hey, my drug isn't being covered. And 9 out of 10 times it turns out to be because they don't have the right ID card to process the prescription at the pharmacy, for example. So please make sure that you are presenting those new ID cards to your provider's offices on or after March 1st. And beginning on March 1st, you can log on to both Aetna and Express Scripts to go ahead and create a member account to go ahead and view your explanation of benefits, get a copy of your digital ID card, or review anything related to your benefits. If you are someone right now in the state health benefits that has Aetna, that member portal will continue to be the same for you. I know that there's some people that are in Aetna with the state right now, so you don't have to create a new profile because that'll be there already for you. Person is asking, what is the overseas coverage situation regarding coverage? My son fell ill during a vacation to Europe and 100% of the doctor's bills were reimbursed. So it depends on the country. And with Aetna, the same coverages apply like they do with Horizon, for example. It is very country dependent. It is very dependent on, was it an emergency versus do you want to see a provider, at a specific country? So 9 out of 10 times what an employee has to do is lay that out of pocket, and then that is submitted and then reimbursed when you go ahead and have the claim processed when you're back. What I know that I was working with an employee recently that their child was going to be spending a semester abroad. And for that, I would definitely recommend getting a different global coverage, not specifically the one through the district, because your child is going to be spending a considerable amount of time out of the country. But again, anything else that I can answer on that question, definitely reach out to us one-on-one. Person is asking if we are losing doctors and prescriptions that we always have been able to use, what are Hillsdale and IMAC doing about that? Are we allowed to see them, receive those prescriptions that they have under Horizon? Does your company or Hillsdale make any accommodations for us? I would say reach out to us because, like I said, there is a tremendous amount of overlap with the doctor networks between the Horizon and the Aetna networks. So very likely that your doctor will live in both. As we mentioned previously, if you are going through a treatment specific like a cancer or pregnancy or any serious critical illness like that, there is transition of care coverage where they would continue that in-network coverage for the duration of that treatment. So again, there is that. And with regards to prescriptions, I can tell you that the prescriptions through Express Scripts and OptumRx are very similar in the sense that they both have very large formulary or list of covered medications. And a bit of an enhancement with the move now to Express Scripts is that they use one formulary for all the plans, unlike with Optum. Optum uses a much more restrictive formulary for those that are in the educators or the Garden State Health Plan. So that is a bit of an enhancement on that end. But again, we will work with employees one-on-one, and I encourage anyone who is in a situation like that to reach out to us. But as I've been doing for the last few weeks, definitely I encourage everyone to reach out to us with their list of medications. Employees have been reaching out to us, giving us the list of medications that they're on. And if, God forbid, there is a drug that is not covered, there will always be a drug for every condition within that same therapeutic class of medications. So there's definitely a lot of workaround with that. Okay. If we have checked with you regarding a prescription that is covered and you tell us that it's covered, but Express Scripts website says it's not, is there a guarantee that we will get that our prescriptions are paid for? When we are communicating to employees what coverages or how their scripts are covered, we're hearing that directly from Express Scripts and the Metropolitan Health Insurance Fund. So I'm not sure where online you may be finding that, and I can tell you that formulary lists, Express Scripts does not have an online search directory. So again, we're checking directly with them, and the list of covered medications that they provided is an illustration of just some that are covered. It is not a full comprehensive list. But again, we are getting it in writing whether or not your medication is covered, and that is how we are communicating that back to you in writing. Perfect. Okay, so with prior authorizations, if you are somebody that's currently enrolled in the state under an Aetna plan, Freedom 1015, or the Educators or Garden State Health, if you have a prior authorization in place, you can contact us and we can have that prior authorization moved over to the new plan come March 1st. But if you're someone who has a Horizon plan like the Direct 15, Direct 10, and the Educators plan, we would need you to have your doctor submit to get a new prior authorization from Aetna, just because Horizon and Aetna are obviously two separate carriers. They don't have the same prior authorization or claims system, so you would need to get that new authorization under Aetna. But again, if you're impacted by this, we highly encourage you to reach out to our office. Same thing applies with prescription. OptumRx, because it doesn't, again, it's a different carrier than Express Scripts, your doctor may need to go ahead and submit a pre-authorization if you have one in place already. And also, there may not be a need for prior authorization under Express Scripts that maybe you had under Optum. So again, if this is something that impacts you, reach out to us. We will walk you through that process of how your doctor can go ahead and submit for that prior authorization. But again, there may be drugs that you have now that don't require that, so you can proceed forward with getting that script submitted. One of the questions that we get a lot when employees are inquiring whether or not they should move or want to move from Direct 10 to the Educators plan is how the contributions are calculated. As you can see from this graphic, the Direct 10 or the Direct 15 plans, they utilize the coverage tier, the salary, and the premium of the plan in order to calculate what your Chapter 78 contribution will be. When you move into a plan like the Educators or the Garden State Health Plan, those contributions are exclusively based on a percentage of your salary, whether it's a family, parent and child, two adults, or single coverage. So there's always going to be a guaranteed savings in the Educators or the Garden State Health Plan as to how your contributions under Chapter 44 are made. But I know that this is a question that's been coming up a lot, that now that there is this new opportunity due to the transition for employees to go ahead and make a plan change, we've been running numbers for employees, and they've been very surprised at the savings that they'll have if they move, let's say, from Direct 10 to the educators plan. So we definitely like to go ahead and go through that. And again, both the educators and the Garden State Health Plan, they utilize different tables of contribution because, again, it's a percentage of your salary rather than a percentage of the premium. And just to highlight some of the differences between the educators and the Garden State Health Plan compared to the new Aetna 10 and Aetna 15 plans, the same network of providers that you have for the educators, the 10 and the 15, is the same network that you'll have for all three of those plans. The Garden State Health Plan, however, only has coverage in the state of New Jersey. Coverages, as we mentioned, contributions, as we mentioned, are based on a percentage of the salary rather than a percentage of the premium. And in the educators or the Garden State Health Plan, it's a $10 copay for primary, $15 for a specialist, and $125 for the emergency room copay, which is waived if you are admitted into the hospital. The two big differences between the educators and the Garden State Health Plans compared to the 10 and the 15 plans is the out-of-network, which we will get into a lot more detail in the next few slides, and also how the prescription functions, because it does function differently than under your current Direct 10 or 15 plan. And just to compare a couple of the plans side by side to one another, and I'm sorry, if we could just make sure that your audio is muted because it is conflicting. I apologize, whoever has their audio on. So in New Jersey, again, the 10, the 15, and the educators plan use the same network of doctors, so that Aetna Choice POS2 open access network. But the Garden State Health Plan, because it is a New Jersey only plan, has a smaller network. We usually don't see much, if any, enrollment in the Garden State Health Plan. Usually employees are living either in Direct 10 or in the educators plan. But again, those three plans, the 10, the 15, and the educators, do use the same network, not only in New Jersey, but also nationally. And again, your co-pays for your primary and your specialist will vary depending on the plan, but they are very similar to one another. And your annual physical, which we always like to take the opportunity during a transition or a webinar like this to make sure, is that employees know that their physical is covered at no deductible, no copay. So we highly encourage everyone to go ahead and get their physical. As we mentioned, all the benefits are exactly the same as you have now in the state, where you're no deductible in network under any of the plans. Out of network, you do have a deductible depending on whether it's single or individual coverage. Same thing with maximum out of pocket, which I always like to take the time to make the distinction that deductible is what you lay out before the plan begins versus maximum out of pocket, which is the maximum that would be laid out in your plan. So again, in network, no deductible under any of the plans. And going back to the maximum out of pocket, again, the most that you would spend in a calendar year, that is dependent. You have different limits in and out of network and whether it's single versus family coverage. Again, to go back to the question that was asked before, no referrals are required in any of the plans that are being offered. You are still able to go to the same labs that you are currently going to. So LabCorp and Quest are your in-network labs. If you choose to go to a lab out of network, as you are now, you are subject to your applicable deductible and coinsurance amount. Same thing applies to outpatient surgery. There is no charge for that in network. Out of network, again, your applicable deductible and coinsurance, and your emergency room copays depend on the plan that you're in, but again, are waived if you're admitted into the hospital. We took the high level of benefits that are mostly utilized for our comparison here, but on the IMAC benefits portal, we have a full side-by-side benefits guide of how the benefits that you have now in the state compare to the benefits that you will have under Aetna, for example. And I believe that was also included in the communication that was sent out a few weeks ago. Person is asking, can you clarify the deductible is not directly related to what the doctor charges, but what the plan determines as customary and reasonable? To answer your question in a few parts, a deductible is the amount that you're laying out before the plan even begins. I think what you're referring to is possibly the reimbursement that you would get out of network, and we are going to talk about that in this slide, so perfect segue to that. We like to discuss out of network specific to the educators and the Garden State Health Plan because it does function differently, and as it is now. So again, no change to how it's functioning now, but as this is an opportunity to connect and discuss this, the educators plan and the Garden State Health Plan reimburse on a different schedule as your direct 10 and your 15. If you're someone that, for example, goes out of network with a high degree of frequency, the direct 10 and the direct 15 are the plans that you should elect because you're highly utilizing out of network benefits. Employees that are in the educators and the Garden State Health Plan primarily stay in network because the reimbursement is lesser than what is reimbursed under direct 10 and 15. Because when you go to a provider, let's say in network, that in-network provider is only able to charge you what their contractual copay amount limit is, whether it's $10 or $15. But when you go out of network, that doctor can really bill whatever they want. And to go to back to the person who asked the question, that reimbursement is not going to be exactly 20 or 30% of what the total bill is. The insurance company, and it happens now, they determine what to reimburse that provider had they been in network, and that's what gets reimbursed back to the member, which brings us to this example. So for example, if you go out of network and a provider charges, let's say $100, Aetna, in this case, starting March 1st, would review the claim and determine that based on the usual, customary, and reasonable amount for that covered service, that service should have been billed at $50. Aetna will pay their 70% in coinsurance, which is in the blue box, that $35. But you as the member would be paying your 30% of coinsurance, which is $15. That gets applied to maximum out of pocket. But that other $50, that's still part of the total bill from that provider, which is in the red box, that is your responsibility as a member to pay, and that is what is known as balance billing. We use this as an illustrative example under the educators and the Garden State Health Plan, but overall, when you go out of network under any plan, they are most likely not reimbursing the full amount that you're laying out because again, there's a percentage of coinsurance and they're paying based on what they deem as usual, customary, and reasonable. So very good question there. Person is asking if we call our doctor and ask the office if they accept Aetna, is that all we need to ask, or is there a certain type of Aetna plan name? Yes. And I also don't like the word accept. Accept, when you call a doctor's office and you say, do you accept this insurance? They'll tell you, yes, we accept everything. That is a very common thing that happens because they really need to say or denote that they participate. If they say they participate, that means that they have a contract with Aetna or even with your current carrier, if you're in Horizon, for example, that they are in network and that they are not going to bill you anything above your copay. But yes, we do have information as to what the exact network of the plan is. We have a slide coming up with that. And I believe in the instructions, in the communication, the actual name of the network was included. But again, we have a slide coming up for that. So good question. Another person is asking, some medications are special mail in orders. Are those also covered? Yes, there is specialty medication that is handled through mail order. I was not able to obtain information for the specific medication because I was not enrolled in the program. Would I be able to know if it's covered before I make a decision? Yes. Email us the name of the medication, the dosage amount as well. We'll get you an answer as to how that's covered. And can we get a copy of the slides at the end of the meeting? Yes. What we'll do is we'll provide Sasha the link to the recording as well as a PDF of the slides. And again, we're also going to post that on the IMAC benefits portal as well. So with that said, with prescription, that really brings us into Express Scripts. Express Scripts is going to be the new prescription carrier come March 1st. We did provide a list of the covered medications, but again, that is not a complete list as they don't actually provide that, to be honest with you. They have that coded in their system, which is why we encourage you, if you don't see the name of your medication on there, don't automatically assume that it's not covered. Reach out to us. We will go ahead and verify that and give you a written confirmation as to how your drug is covered. We do have that list, as we mentioned, on the IMAC benefits portal. And again, your medical plan dictates the prescription plan that you're in. So again, if you're in the 10 or the 15 plan, you will continue to pay a 10% coinsurance, which is how it's currently being handled. If you're in the 10 or the 15 now with, let's say, Horizon, you're paying 10% of your medication under Optum Rx. But if you're in the educators or in the Garden State Health Plan, your copays would be $5 for generics and $10 for what is considered a preferred brand name drug. But as we mentioned, under the educators and the Garden State Health Plan, as it is now, those plans have a more restrictive prescription option where they do require the use of mandatory generics. So again, only in the educators or the Garden State Health Plan. But as I've been talking to a lot of members, they are realizing that they are already on generics. Most providers don't necessarily write must be brand on the prescription, and most retail pharmacies, they automatically dispense generic drugs. So again, if you're someone who is looking to maybe save on your contributions, reach out to us. Let's understand your situation better, how you and your family utilize your medical plan and your prescription plan to see if a move maybe to save you money on your contributions would be a good fit for you. Someone had asked earlier about mail order. So yes, as of March 1st, the carrier for your prescriptions is going to be Express Scripts. So you would have to go ahead and set up the Express Scripts mail service for mail order if you're choosing to get something mailed. Like for example, we see that members that are on maintenance medications such as cholesterol, insulin, and medications that you are going to be on for the foreseeable future, members usually like to have that set up via mail order. Same thing if you're on a specialty medication, that's also handled via mail order. So your provider can either do an e-prescribe, which is what most doctors do now. But again, you're letting them know and presenting your new ID card come March 1st. But you can also go ahead and have that set up through the online or mobile app for Express Scripts. Your doctor can also fax the script, or they can call it in. But usually what I see with most members and in most practices nowadays is that the e-prescribe, the electronic prescription, that's what's being used to submit for whether it's mail order or even at your local retail. Most doctors are just sending that directly to the pharmacy versus giving you an actual written script. Person is asking if a generic drug can't be tolerated or it doesn't work, can a preferred drug be authorized? Yes, that's something that, and again, to answer your question, that is something specific to the educators and the Garden State Health Plan. It's not applicable within the 10 or the 15 plan, but under the educators or Garden State Health Plan, it is a mandatory generic first that is required. But definitely there is an appeals process, and your doctor can go ahead and submit clinical notes to prove medical necessity. So yes, that's definitely an option. Person is asking how many mental health visits are included per year in the New Jersey Educators Health Plan. It's unlimited. There is no limit or cap on mental health visits. But I can tell you that under the Educators Plan, it would definitely behoove you to find a provider in network versus going out of network for that. Just because with mental health visits, those are usually more high frequency. You're going either once or twice a week and you're going weekly, for example. But definitely reach out to us if there's a provider that you're looking at that maybe, or that you can't find any information about. But yes, there is no limit to mental health visits in the Educators Plan, or in any of the plans really. So again, just to reiterate the prescription highlights for the educators or the Garden State Health Plan, $5 on generics, $10 on preferred name brand drugs. And again, to answer that question regarding could you move up and get a preferred brand if a generic isn't covered or isn't working, I should say, yes, members do have that option. Same thing applies for mail order. So if you do the mail order on the maintenance medication, let's say you're on a cholesterol medication, definitely I would encourage you to do the mail order because you'd be paying a $10 copay for a 90-day supply via mail order versus a $5 copay for just a 30-day supply. But again, the big takeaway is the mandatory generics, potential step therapy where you have to try other drugs, again, under the educators or the Garden State Health Plan, with regards to the prescription there. But again, reach out to us. We can certainly speak to you one-on-one and better understand your situation. And again, with step therapy, that is something that is happening now under Optum, I should say. So again, that is something that's applicable, but really under the educators or the Garden State Health Plan. So next steps, if you are not making a change and you're happy with the benefits that you have now, we will just take that information that's in Benefit Solver, and that's what we're going to be moving to the new Aetna for medical and Express Scripts for prescription. But if you are looking to make a plan change, or if you're looking to waive coverage, you would need to complete a form. The IMAC portal now has all of the plans loaded there, and you can go ahead and compare them and review them side by side. And also we have the contribution calculator already built in there that you can go ahead and use to see what your contributions would be under your Aetna 10 plan versus the educator's plan, for example. We do have the doc find instructions on the IMAC benefits portal, but we have a slide coming up about that. And those instructions also were included in the communication. Your next open enrollment period would be May of 2027 with an effective July 1st, 2027 date. And again, if you are looking to either make a plan change or waive your coverage, that would have to be sent to Kathy Brancato. Sasha, unless there's somebody else, that's who we think is the person that's getting these waiver or change forms. But if there's someone else, please let us know.
Oh, Kathy's the appropriate person. Thank you.
Perfect. And Kathy, I see that there. We'll make sure we update that. So thank you for sending that to us. We'll make sure we update that. Thank you. So on the IMAC benefits portal, as I've been referencing all along, we have everything that we've presented so far. A recording of this presentation will be posted there, PDF of all the slides as well, so you can look at them at your leisure. But again, that would be at imacbenefits.com, and you would put in Hillsdale with a capital H as the guest key. There is no personal health information on this portal. It is just a portal that houses all of the information regarding the health benefits at Hillsdale Public Schools. When you go onto the portal, you'll see the contribution calculator. This is what the landing page of the calculator looks like. So you'd be basically picking which plan you would like to get your contribution information about. The calculator is going to ask you what your salary is and whether it's family, parent and child, single, or 2 adult coverage, and it will automatically let you know what your contributions would be per pay, per month, and on an annualized basis. But as we said, moving to the educator's plan, for example, is a guaranteed savings compared to the 10 plan. I can tell you that I was running the numbers the other day for someone who had a family plan. I believe her salary was about $94,000, and her savings moving into the educator's plan was almost $10,000 per year. So this is a significant savings. The educator's plan has been around now for 5 years. So again, something that we always like to take the opportunity to mention for employees considering making a plan change. And while this is an open enrollment opportunity, now that you are moving to the Aetna and Express Scripts plans under the Metropolitan Insurance Fund, you'll have 30 days to go ahead and make any changes with the exception of the birth of a newborn, which is 60 days. Kathy will update this on the slides that we'll use to make sure we include your correct email, and I apologize, we didn't know that ahead of time. But you would then submit that documentation to Kathy's email, and the coverage would be retroactive back to that event. We like to remind everybody that you do have a certain defined period of time outside of open enrollment to make these types of life changes. And if you do miss that opportunity, you would have to wait until the following open enrollment. So it's important to note that 30 days for everything with the exception of the birth of a newborn, which is 60 days. And moving forward, your open enrollment will take place in May with coverages and changes being effective on July 1st. So open enrollment is your annual opportunity to add or remove dependents, change between plans, waive coverage, or enroll in coverage if you've previously waived. For those of you that may have dependent children that are aging out, they age out at the end of the calendar year, and moving forward in Express Scripts and in Aetna, they do have options, as they do now with COBRA as being something available to them. Chapter 375, which is a New Jersey state mandate that we're going to go ahead and review in the next slide. And if you have a special needs dependent child, there is coverage for those overage dependent children with disabilities, and we have forms that we can provide you to go ahead and get their coverages set up. Person is asking here, what about divorce, which sometimes may fall outside of 30 days if you need the divorce decree? Usually, the moment that you get the divorce decree is the day that you're actually divorced, and that is when you can submit that. But I've seen situations where employees have had a divorce agreement or divorce settlement agreement handled ahead of the actual divorce being granted. That can also be used in order to remove that spouse So again, reach out to us if that's a situation applicable to you. So under Chapter 375, which is a New Jersey state mandate, your dependent child that is aging out at the end of the calendar year in which they turn 26, they would be able to stay under your plan until the age of 31, so long as they meet the following criteria: that they are not married, have no dependent children of their own, live in the state of New Jersey, or are a full-time student outside of the state, and that they're not entitled to any other coverage or Medicare. They are able to go ahead and elect the same medical and prescription plan that you're currently in, at about 68% of the single premium of the plan. We mention that because COBRA is incredibly expensive. COBRA is 102% of the premium, whereas Chapter 375 is about 68%. So again, it is a significant savings. And I can tell you that this is something that with the increases that have come to the plans in the ACA in the marketplace, Chapter 375 has been something that employees have been able to utilize at a lesser rate than those plans for those overage dependents that just have no other coverage of their own. But we do have a link on this on the portal. And again, reach out to us if this is something applicable to you. For the person that was asking about the doc find, so we do have these instructions on the portal as well. And basically, you're navigating through Aetna's website to go ahead and determine under the plan that you're in, if your provider, if a hospital, or any other type of specialist, for example, that you're searching for, how they would be covered. So, for example, for most of you that are either in Direct 10 or 15 or the Educators Plan, you would be going to the Aetna website, search for a provider, and you would be electing the Aetna Choice POS2 Open Access Network. I know someone earlier asked if you were calling your doctor's office, what are you telling them? This is the name of the network, the Aetna Choice POS2 Open Access Network. This is Aetna's largest network. So if you're in 10, 15, or the Educators, this is what you would be searching under on Aetna's website, or if you're calling your provider's office. But again, this is a very large and Aetna's most robust network as well. But if you have an issue not finding a doctor, please reach out to us. We can also connect directly with Aetna to figure that out for you. With that said, if there are any other questions, please put them in through the chat. Yes, Hackensack is part of the network. Again, between both Horizon and Aetna, there's about a 95% overlap. I can tell you that the major hospitals in the area like Hackensack, Claramas, Mountainside, Morristown Memorial, Chilton, St. Joe's and Patterson, Englewood, yes, those are all in network under Aetna. Again, Aetna, believe it or not, Aetna has a slightly larger network in the state of New Jersey than Horizon. Yes, to Valley. And I should have remembered Valley. My daughter was born there. So yes, Valley is in the network as well. But yes, you were going to be very surprised of how large the Aetna network is. And I know that as we've been connecting with members, there's been a lot of anxiety of whether their hospital or their doctors, whether they're going to be covered. And like I said, because of the large overlap between both Aetna and Horizon networks in the state of New Jersey, for the most part, 95% in both networks, I don't think you're going to have an issue. But if you do, reach out to us. Same thing applies with hospitals in New York City, a person's asking. Or even in the border. I know with Hillsdale, you guys are very close there to the New York State border there. So definitely hospitals in the state of New York, and it's a national network. So the same national network that Aetna has for 10, 15, they also have for the Educators Plan, and that includes your large hospital systems in New York like Sloan Hospital for Special Surgery, Columbia Press, Lenox Hill. So all of those are part of Aetna's not only New Jersey, but also national network. CHOP in Pennsylvania for children. So yes, all of that, they're in the network. But again, you have until January 23rd to go ahead and make any plan changes if you are looking to do so. If not, there is no action required on your end. We will just move everything over electronically behind the scenes. And again, you will be getting your ID cards by mid-February in anticipation of the March 1st effective date. So you can present that to your doctor and pharmacy. But again, I highly encourage you to reach out to us. You can call our office. We have a live person answering the phones 8 to 5 Monday through Friday. You can send us an email as well. We look forward to hearing from all of you and meeting a lot of you. That's right. We're going to be on site starting next week. We look forward to connecting with you in person. Sasha or Julie, is there anything else that you'd like to touch upon before we wrap up?
I just wanted to mention, well, first of all, thank you, Liz. Thank you, Julie, for you guys in the presentation. The slides and the presentation will be on the employee portal under the Human Resources tab. I will do my best to get it up there tomorrow. If not tomorrow, then it'll be the following day. I don't know. It all depends on when you guys give it to me. So, but I will get it up as quickly as I can. And that's it on my end, Julie.
Just want to emphasize the importance of making sure that everybody's addresses are updated, because ultimately the information that we have from Benefit Solver is what we're loading into the Aetna and Express Script system, and that is where people's cards will be mailed to. We did a couple implementations for January, and there was a lot of people that had moved over the years and not updated accordingly. So there was a lot of re-requesting ID cards at the last minute. So if everybody could just take a minute to make sure that all of their information is up to date. That way we can ensure everybody gets their ID cards and any other literature on time.
Correct.
Oh, I'm sorry.
No, I was just going to say, Sasha, that to verify what address is on file that we're going to be loading into Aetna and Express Scripts, it's what's in Benefit Solver. So you can always go back into Benefit Solver and just double check. And if it is different than what is in there, please let the district know so they can go ahead and have that updated on the employer side of Benefit Solver, because again, that's where we're going to be running the reports from.
And I just wanted to circle back to the in-person sessions. For anyone who's on this call or on this webinar who is an employee at George White, please feel free to utilize either of the elementary school dates and locations for your convenience.
Perfect. Yes, we'll be at Ann Blanche on January 13th at 3:20, and we'll be at Meadowbrook on the 15th at 3:20 as well. Perfect. All right. Thank you so much for your time, everyone. I hope you have a great rest of your day. Oh, someone's asking. Is the benefits calculator working? I haven't been able to work it for a few days. Does it require a certain operating system? Yes, it is Excel based. So you do have to have Excel 2013 or later in order to use it. But if you don't have access to that, call us. We'll run those numbers. Call or email us. We'll run those numbers for you, as we have for a few other employees that have reached out with contribution information. So thank you. All right. Thank you so much, everybody. I appreciate your time. Have a great rest of your day.